Hello, everyone, and welcome. Thank you for joining us for today's Canadian Foundation for Dietetic Research webinar, Diet and Dental Caries, Recent Insights from Canadian Dietitians and Oral Health Professionals. I'm Marcy Cooper, and I'm the co-chair of the CFDR Board of Directors, and I'll be your moderator for today's webinar. On behalf of the Board of Directors of CFDR, we welcome you today to our brand new webinar series. As a not-for-profit organization, we rely on the support of our partners, such as industry and individual support. CFDR supports innovative research projects in nutrition and dietetics to enhance dietetic practice and ultimately to improve the nutritional health of all Canadians. We've invested over $3 million in nutrition and dietetics research. We have 29 peer-reviewed publications of CFDR-supported research since 2011, and we have supported 125 research teams. So today's webinar is very generously being sponsored by Haleon. Haleon is a global leader in consumer health with the purpose to deliver better everyday health with humanity. Haleon's product portfolio spans 6 major categories: oral health, vitamins, minerals, and supplements, pain relief, respiratory health, digestive health, and therapeutic skin health, and other. Built on trusted science, innovation, and deep human understanding, Haleon Canada brands include such things as Advil, Buckley's, Centrum, Emergen-C, Flonase, Neocitrin, Nexium, Polident, Robitussin, Sensodyne, Tums, Voltaren, and more. For more information on Haleon and its brands, visit www.haleon.com. We'd also like to thank Dietitians of Canada for their continuous organization, brainstorming, and technical support for the webinars, specifically Amanda Speroni and Amit Acharya. So speaking of webinars, I'd just like to put in a heads up for next week's webinar, same time, next Thursday, September 25th, to honor the National Day for Truth and Reconciliation on September 30th. Our speakers will be Dr. Rona Hanning and Dr. Sandra Utilainen. So if you have not registered yet, here's a QR code for you to register or look out for that webinar. So I'd also like to give a heads up. We're very happy to announce, this is sort of a pre-announcement, that we're going to be hosting a research showcase next March 4th and 11th in the afternoons. And abstract submission will be in November 2025. Look out for information on this by the end of this month. This will be in Nutrition Month. And as I said, we're extremely excited to be hosting this. So I'd like to also congratulate the 2025 CFDR Annual Grant Awardees. We were able to do 5 grants this year to 5 different teams. You can see more information on our website, cfdr.ca, under the news section for more specifics on these grant awardees. So I'd also like to announce something else, which is the 2026 grant competition, which opens October 1st. So information is already populated on there, but the actual process will not start until October 1st. So that's when our grant registration opens. The deadline is October 31st. People will be notified whether they will be doing a full proposal by mid-November, and then full proposals will be due March 4th, 2026. So I suggest that you look on our website, once again, cfdr.ca, under the research section, and you will find all the details. So just my apologies. So these are our social media channels: LinkedIn, Facebook, and Instagram, and you can see information from us on those channels. We've been trying to populate it more, be more active on those channels. So before we begin, a quick housekeeping note, and that is please feel free to type questions in the chat box as we go, and we'll do our best to address some of those questions at the end if we have time. And yes, so please in that chat box, not in the question and answer section. So about our speaker. I'm pleased to introduce today's speaker, Dr. Jessica Lieffers. Jessica is an associate professor and registered dietitian in the College of Pharmacy and Nutrition at the University of Saskatchewan. She is a co-author of almost 40 peer-reviewed articles in various topics related to nutrition and dietetic practice. Much of her current research focuses on nutrition and oral health, but she is also working on other projects to help enhance various aspects of dietetic practice. Jessica is also on the board of editors for the Journal of the Academy of Nutrition and Dietetics, and is also a reviewer board member for Applied Physiology, Nutrition, and Metabolism. Jessica has received 2 CFDR grants as a PI, one during her PhD and a second one as a tenure track faculty member. With that, I'm pleased to hand things over to Dr. Jessica Lieffers to kick us off with recent findings in Canadian dietetic practice related to dental caries. Jessica, I will stop sharing and then you can share.
Okay, can you see my screen? We'll assume that you can. I'll keep going.
Yes.
Perfect. Okay, great. Well, thank you for the wonderful introduction, and I'm so delighted to be here today. And I'd first like to start off by thanking CFDR for the invitation to speak to you all today about the topic of nutrition and oral health, and I'm very overwhelmed by all the interest in this topic. And I would also like to express my sincere thanks to CFDR for supporting the project I'll be speaking about today. There's very limited funding opportunities available for dietitians to conduct practice-based research, making CFDR's grants an invaluable resource for dietitians across Canada to carry out these activities. And these grants really do serve as a vital catalyst for Canadian dietitians to explore innovative research ideas. And I'm incredibly grateful to have been awarded 2 CFDR grants in the last 10 years or so, and this program is very close to my heart, and it's played a significant role in helping me grow as a researcher and to get to where I am today. And I'd also like to thank everyone who's joined today or is listening to a recorded version of this webinar. Thank you for your interest. The title of my webinar today is Diet and Dental Caries, Recent Insights from Canadian Dietitians and Oral Health Professionals. So I'd first like to begin this webinar with a land acknowledgement, and the land on which I live, work, and play, and where the Saskatoon campus of the University of Saskatchewan is located, is Treaty 6 territory and homeland of the Métis. I want to quickly start off with an overview of today's webinar. First of all, I'm going to talk about some background information on oral health and the burden of oral disease in Canada. And I'm going to have a brief discussion of diet and dental caries. And I just warn you, I'm going to scratch the surface of this. We could have a whole webinar just on this topic. So some of this may be review for some of you, and for others, it may be very new information. And I recognize that participants in this webinar are coming with varied levels of knowledge and experience related to diet and dental caries, and some of you may work directly in this area and are very familiar with the topic, while for others it's entirely new. So I'm hoping that there'll be something for everyone in this webinar. After that, I'm going to talk about some findings from my recent CFDR-funded studies that captured information on the knowledge, attitudes, practices, and perspectives of Canadian dietitians and oral health professionals regarding diet and oral health, and we are going to be focusing on dental caries here. So oral health has important implications throughout the lifespan and can cut across many different areas of dietetic practice. And oral health is vital to quality of life, and we also know that oral health is related to systemic health. Nutrition and oral health also have an important two-way relationship with one another. Poor oral health can impact dietary intakes, and poor dietary intakes can also impact oral health too. And 4 life cycle groups have been identified as being at elevated risk for oral health issues, and many of these issues have interactions with nutrition. These life cycle groups are pregnancy, early childhood, adolescence, and older adults. And I'm briefly going to talk about some examples of oral health issues at different time points in the life cycle. Again, I'm only going to scratch the surface here. We could spend a whole webinar on each of these groups. So for pregnancy, hormonal changes during pregnancy can lead to gum inflammation, bleeding, loose teeth, and reduced saliva production, all of which can increase the risk of oral health issues. And additionally, morning sickness and food cravings may contribute to oral health issues. Importantly, poor oral health, especially periodontal disease during pregnancy, has been associated with adverse outcomes such as premature birth and low birth weight, and we don't completely know why this is the case yet. For early childhood, infrequent brushing and limited exposure to fluoride can increase the risk of oral diseases in young children. In addition, some feeding practices, such as sleeping with a bottle with sugary liquids in it, or prolonged use of bottles or sippy cups, can heighten the risk of of dental caries. And early childhood caries, which is the presence of tooth decay in children under the age of 6 years, can also negatively impact eating habits and could be a contributor to undernutrition in this group. And access to dental care can also sometimes be a challenge for this group. The Canadian Dental Association does recommend that children have their first dental visit within 6 months of the eruption of their first tooth or by age 1, but we know that some children may experience barriers getting dental care at a young age. For adolescents, adolescents face increased oral health risks due to their frequent snacking, consumption of sugary drinks, such as soft drinks and energy drinks, and irregular eating patterns, all of which can contribute to dental caries and dental erosion. And eating disorders in this group, which can also sometimes be present, can further impact oral health too. And individuals in this group who wear orthodontic appliances, those may trap food particles, which can increase the risk of tooth decay as well too. And oral hygiene also may be neglected in this age group as well too. Now, lastly, for older adults, oral health concerns are particularly significant in this group. And age-related changes in medications often lead to dry mouth or xerostomia, which increases the risk of dental caries and denture issues as well too. And tooth loss and poor dentition can impair chewing and can be a contributor to malnutrition. And as well, physical and cognitive challenges such as stroke and dementia can affect both dietary intake and oral hygiene. And limited mobility may also restrict access to dental care in this group. So the document that I have on the right side of this slide is a collaborative position statement from Australia that was done in collaboration with Dietitians Australia and Dental Health Services Victoria. And this provides an excellent summary of oral health issues in different age groups, and is where I got some of the information today. But if you are interested more in oral health and nutrition, this is a great document to take a look at. So dental caries is the most common non-communicable disease worldwide and in Canada. And the most current data that has captured measured oral health status of a representative sample of Canadians was the Canadian Health Measures Survey Cycle 1. And this actually took place more than 15 years ago, from 2007 to 2009. And this survey found that about 60% of children have had experience with dental caries, and 96% of adults have also had experience with that. And we know too that dental caries can be very high in some communities, above 90% in certain communities. And also another stat for Canada is that treatment of tooth decay is the most common reason for day surgery in children under the age of 6. So one thing that is exciting, this representative data that we have is quite old, but there is some data that was captured in CHMS Cycle 7 from 2022 to 2024, and this captured measured oral health status in individuals 1 to 79 years of age. And this data is expected to be released soon. So stay tuned for some updated oral health statistics using measured data coming soon for Canada. So we talk about dental caries a lot, but we don't often stop to think about what the definition of dental caries is. And I'm going to provide you with one here. It's a bit of a long definition, but I think it's one that's commonly used in this community. So it's a biofilm-mediated, sugar-driven, multifactorial disease, meaning it involves several factors, including diet and the presence of bacteria in the mouth, and that produces harmful acids. And the balance between disease-causing pathological factors and protective factors, such as the use of fluoridated toothpaste and regular oral hygiene, influences the initiation and progression of this issue. And dental caries is used to identify both the process and the outcome of the process, which is a cavitated or non-cavitated lesion on the tooth. And I have some pictures of that here on the right. And it can affect any part of the tooth. It can affect the crown, which is the top part of the tooth that's above the gum line, that's covered with enamel, which is a very hard substance, or it can affect the roots as well of the teeth. And the root caries are particularly common in older adults and those with gum recessions. And it's sometimes called tooth decay, dental cavities, or caries. And it's important to note too that dental caries is a chronic condition that develops over months or even years, and it does not develop over the course of a few days in most cases. So it takes a while for it to happen. So dental caries is a very complex phenomenon, and at the very core, we need to have three factors. We need to have a vulnerable tooth structure, we need to have bacteria in plaque biofilms, and we need to also have dietary factors or sugars that cause it. So that's at the very core of the process for dental caries. Again, this may be review for some of you, it may be new for others. So what happens is when we have healthy tooth enamel, which is on the panel on the left, and the tooth enamel has bacteria on it in bacterial biofilms, and then it's exposed to fermentable carbohydrates. And we'll talk about those more in a second. That leads to acid production. So the bacteria ferment the carbohydrates in the mouth, and it's usually Streptococcus mutans is usually the most common bacteria that's implicated for caries, but there are a lot of other bacteria as well that can do that. And these are bacteria that either produce acid or thrive in an acidic environment. So they produce acid, and once the pH in the plaque becomes below 5.5, we start getting tooth demineralization. So that's where we start losing calcium and phosphate from the tooth. Now, what happens is saliva then comes into play, and it brings fluoride, phosphate, and calcium ions, and that causes a remineralization process. So, and you can bring the tooth back to a healthy enamel state. Now, if the remineralization and demineralization become unbalanced, you're going to end up with caries. So I want to come back to this image again, and this model, which is a socio-ecological model, may be familiar to many of you, as we often think about it in terms of factors that affect food intake. But it's also been applied to demonstrate how caries is a multifactorial disease. And although we need the three factors in the center of this diagram, there are also numerous other factors that can determine whether someone will develop caries and the severity of their caries as well, too. So these include the oral cavity environment, and those include things like saliva, fluoride, use of dental sealants, whether people chew gum with xylitol in it, so sugar-free gum, and the oral microbiome too as well. And there's also individual level influence as well. So those include things like genetic factors. And I know there are people in Canada doing research on genetic factors as well with that. We have health behaviors, and we also have access to dental insurance as well too. And then we also have family level influences. And so those are things like social support, socioeconomic status, and family-related health behaviors. And then we also have community level influences, and these include things like characteristics of the dental care system. So again, more certain things will be more or less relevant for the individual depending on their situation. So next, I would briefly like to talk about some terminology related to diet and dental caries, and this probably is of interest to mostly a dietetic audience, dietitians and nutrition students, but I know there's people from other disciplines as well likely joining. So the first one I want to mention is it's on the top left-hand corner, and it's cariogenic foods. And these are foods and drinks containing fermentable carbohydrates that can cause a decrease in that plaque pH to less than 5.5. And that pH of less than 5.5 is usually the point where we think that demineralization, so that loss of tooth structure starts to occur. So that's important. We'll talk about that in a second. We have karyostatic and anti-cariogenic foods, so kind of on the top right and the bottom left. And these are foods that are either promote remineralization, so promote the generation of more healthy tooth structures again after that remineralization, or foods that are not metabolized by those plaque bacteria and they subsequently don't cause that drop in pH. And then we also have acidogenic foods, and these are foods and drinks that decrease the pH in saliva to less than 5.5. And I'm not going to have time to talk about that today, but basically these are foods and drinks that are acidic, and they can cause dental erosion, which is when tooth enamel is chemically removed due to the presence of acid in the mouth, and that can make a tooth structure more vulnerable to dental caries and other oral diseases too. So I'm going to talk first about cariogenic foods. And I can't talk about cariogenic foods without talking about fermentable carbohydrates. So this is a term that's used a lot in the dental community. So these are carbohydrates that can be metabolized by bacteria in the plaque biofilm, and they can decrease the pH to a level that causes demineralization. So that's that pH of 5.5 generally. But again, it can vary depending on different situations, but generally it's 5.5. And some examples of fermentable carbohydrates, and this won't come as a surprise to anyone in this audience, are things like free sugars and processed starches, which are things like potato chips, crackers, biscuits, and these are starches that are partially broken down or they're cooked. And free sugars have been found to have a particularly strong association with dental caries. And in 2015, the WHO released a very famous document on free sugar recommendations, and they recommended limiting free sugar intake to less than 10% of total energy intake. And they also further recommended a decrease to 5% for an additional reduction in the risk of dental caries. So the recommendations from this document, which a lot of us as dietitians use on a daily basis, were actually based largely on studies related to sugar and dental caries. So now what about sugar frequency? There's been a long-standing debate in this discipline about whether it's sugar amount or frequency that can be more or less important in terms of dental caries. And I'm going to argue that both of them are important. I think we need to think about both of them with this. So sugar amount, we know WHO guidelines, but sugar frequency is important too. So research that goes back all the way back to the 1940s by Dr. Robert Steffen found that once sugars are consumed by an individual, the pH in the plaque drops within a couple of minutes of eating it to a critical value of 5.5, and that's when demineralization of tooth enamel can begin to occur. And they found that it stayed at this pH of about 5.5 for about 30 to 40 minutes until the remineralization process occurs, until the saliva comes in, neutralizes that. So this is an important concept to keep in mind when thinking about sugars and dental caries, that pH can stay below 5.5 for quite a while until it comes back up again due to various factors. So I'm going to show you a couple of diagrams here about why eating sugary foods less often may be important. So, and this is some practical examples here. I got these from diagrams from the National Health, NHS Health Scotland, and they have a document on nutrition and oral health and nutrition guidance for professionals. So on this first image, this is an example of what happens when in the mouth when mouth pH when individuals eat sugar. And you can see here that all of the red sections represent the time that that pH is below 5.5. So if someone is eating sugar frequently throughout the day, they're sipping on drinks, they're nibbling on sugary foods, they're going to have more time where their plaque pH is exposed to a pH of 5.5, which is where demineralization occurs. So you can see here that eating sugar frequently throughout the day results in more time where individuals would be exposed to a pH where demineralization would be occurring. Now on the right side, I have a graph here where it shows someone who is not eating sugar as often, and they're eating it with meals too as well. And so you can see here that there's less time that the mouth is exposed to a pH of less than 5.5. So again, we would expect that there may not be as a higher risk for caries as well too. So this is why sugar frequency is also important too. But again, if someone is eating very low amounts of sugar, this may be less important too, but I think they're both important. And we know people are going to eat sugar. So if we are going to have people eat, if people are going to eat sugar, we could tell them to eat it with meals and as well as rinsing their mouth out with water after it to help decrease the risk of that. So related to sugar frequency too, in the UK, dental professionals have voiced some strong concerns about the rising popularity of fruit-based baby pouches, which are widely available and they're very valued for their convenience. And these products are found to contain high levels of sugar, and dentists have warned in the UK that when young children are constantly sucking from the pouches, it increases the duration of sugar exposure on their teeth, and that can raise the risk of early childhood caries as well too. So having that sugar on the teeth from sucking the pouches frequently over time could be a risk factor for that too. Now, what about starch and dental caries? I'm not going to talk about this for very long, but I just wanted to mention it. So foods like rice, potatoes, and corn, they do contain starch, but the glucose strands are very long, and therefore it's hard for the salivary amylase in the mouth, which we know starts to break down starches. Um, and we know that it's hard for the salivary amylase to break those starches down into fermentable carbohydrates that can be used by the bacteria in the mouth. So starches are not really considered to be cariogenic, but if they did stay in the mouth for a really long time, they potentially could be. And there's maybe some people that may be at higher risk of getting caries from starches. And limited studies have not shown a really strong relationship between starch and caries. And this is a recent study that was done in Finland that has shown that there wasn't really much of a relationship between starch intake and long-term changes in caries over a period of many years. Now, however, starches that are more processed, so have undergone gelatinization, are more cariogenic than starches that have not. And this is because the starch molecules are broken up into smaller components, such as things like maltose, and they can be accessed by the bacteria for fermentation. And these foods are also known to be quite sticky as well, so they can stick to the teeth. And foods that are rich in free sugars and starches, so things like bread and jam, cakes, pastries, and sugary cereals, are thought to be more cariogenic than either alone because you have a sticky starch with a free sugar on it. It's going to stick to the teeth, and there's going to be more time for the bacteria to ferment those carbohydrates into organic acids. And this is a review article that looked at 50 years of research on this topic, so 1970 to 2020, and they only found 5 cohort studies that talked about this. So not a lot of research in a 50-year period, but they did find that frequent between meal intake of sugary and starchy foods, so that combination was associated with higher risk of caries. So again, eating these foods between meals could potentially be more harmful. So it is best if people are going to have them, if they can eat them with meals, if they are able to, or if they can't, they could wash their mouth out after with water. Now, lastly, on cariogenic, I'm just going to talk about vegetables and fruit. Now, vegetables and fruit do contain some fermentable carbohydrates, but are considered to have a low cariogenity. And that's due to their high water content. And the sugars also within the cells are less bioavailable for plaque bacteria. So the plaque bacteria can't really have access to them, and they clear them out relatively quickly. And these foods also stimulate saliva production because they're chewy and fibrous too. We also know that's protective against dental caries too. So again, not worried about vegetables and fruits for except maybe dried fruit, but fresh ones, no. But dried, it could be different because they could get sticky on the teeth. So now I'm going to talk a little bit, just for a couple minutes, about anti-cariogenic and cariostatic foods. So these are foods that are more protective in terms of dental caries. Either they have no effect or they could have some protective benefits as well too. So sugar substitutes are one component that is considered to be cariogenic. They're not fermented by plaque bacteria to produce acid, and therefore they're considered to be cariostatic. They don't have any impact on caries. Protein-rich foods too are considered to be most cariostatic and maybe a little bit anti-cariogenic too, but they contain phosphorus, which is anti-cariogenic, and that increases the availability of phosphate for some remineralization activities. And some proteins can be metabolized by mouth bacteria to produce alkaline end products. So that could actually increase the plaque pH, which is a good thing. Fats are also considered to be cariostatic too. They provide a coating on the teeth and provide a barrier for fermentable carbohydrates and the bacteria. So there's a barrier there. And fat can also speed up clearance of food from the mouth too, which can be also less availability of fermentable carbohydrates for the bacteria. And water is another drink that's really anti-cardiogenic. This is very heavily promoted in the dental community, and for good reason too. It's people should be encouraged to rinse their mouths out with water after eating sugars, so that they're not available for plaque bacteria too. And so it's very heavily promoted for prevention of tooth decay. I also want to touch on just briefly dairy products. So dairy lactose is which is the primary milk sugar. It is considered to be cariogenic, but it's not as cariogenic as other common sugars. But if it is exposed to the teeth for a very long period of time, there can be you can potentially get caries from it, but it's not as carcinogenic as other sugars like sucrose. And we know that dairy products also contain things like phosphorus, calcium, and milk proteins, primarily casein, that are all anti-carcinogenic too as well. So that's something important with milk, because you have a sugar which is not really that carcinogenic, and it's packaged with other components that are potentially anti-carcinogenic. Now, this is a diagram here. I'm not going to go through it, and it's not perfect, but I just wanted to say that it does show all of the different types of components in dairy products that could have impacts on the dental caries. So some things, like some components may be antibacterial, some of them may they can inhibit demineralization, aid remineralization. They can help solidify the enamel too in the remineralization process too as well. So there's a lot of components in milk that could have benefits towards dental caries. Now, what about plant-based milks? So there isn't a lot of research on that in terms of dental caries, but these three studies are all mostly they're lab-based studies, so we don't have a lot of other research on this topic right now. But what I would say, this overall takeaway that I got from these studies was that sweetened plant-based milks, some of them can be quite carcinogenic in lab settings as well too. And there tended to be a lot of variability in the different plant-based milks as well too in terms of caries. So again, not all of them are the same. Some of them may be they wouldn't necessarily promote bacterial growth or caries, but others of them could be quite strong in that area, and especially ones that are sweetened. And these products also don't have all the components of dairy milk. We don't know as much about them either, too, because they are newer. So again, just as I just want to say that to the audience about plant-based milk. So some of them could have some risk of caries with them if with that. But again, not all of them. So the last slide I'm going to talk about on this background information is just thinking about overall diets and whether they could at risk for caries or not. So there's a lot of different factors. When you look at someone's overall diet, a lot of different factors could affect whether it could be risk factor for caries. So the frequency of fermentable carbohydrate consumption is important, and also the amount of it, but also includes the form of the food. Are the foods sticky foods? Are they ones that clear the mouth easily? So again, that can depend on that. Is a foods retained in the mouth for a long time? That we know that is associated with risk of caries, versus if they're cleared out, the risk would be a lot less. What is the nutrient composition of it? Are there a lot of anti-cariogenic or caristatic factors in the diet as well too, alongside with cariogenic too? So again, thinking about that, does the diet have the potential to stimulate saliva? Is there going to be a lot of foods that will stimulate chewing and saliva production? We know that's protective towards caries too. And food combinations are important too. So starch and sugar combined foods, we know those are likely more cariogenic than either of them separately too as well. So now I'm going to switch gears. I'm going to transition into talking a little bit about my CFDR funded work. And because of the strong linkages between nutrition and oral health, I was interested in learning more about professional practices and perspectives on this topic. And one of the things I did first when looking at this was I completed a scoping review on this topic with some other team members from the University of Saskatchewan. And what the purpose of this scoping review was to identify and map studies that have captured information on the real-world nutrition care practices of oral health professionals and dietitians to optimize oral health. So we actually found 70 articles on this, which is a lot, but there were only 6 that had information on dietitian practices there. So that was a lot of them were focused on oral health professionals. There was only 1 article from Canada. And the other thing was too is amongst the 70 articles, most of them were capturing like maybe information about nutrition counseling, for example, in one question on a larger survey. So they didn't capture any information in detail. So it really was a clear research gap. So my CFDR grant helped to investigate this further in Canada. So the overall goal of this research was to explore the knowledge, attitudes, practices, and perspectives of dietitians and oral health professionals regarding nutrition for the prevention and management of oral diseases. And we decided to focus early on dental caries. And I want to give a really big shout out to two of my students who have done quite a bit of work on this project. So first student is Amanda Van Zan, and she did the survey study on dietitians that I'm going to talk about as part of her, it was her master's project. So I'll talk about some of her work there. And then Nagin Faramazi Garis is a PhD student, and she's done some work on the oral health professional side too as well. She's currently finishing up her analysis on this. So I just want to give a shout, and I wouldn't have been able to do this project without their help. So the research approach that we took for this project was we actually had 4 studies. So it was an ambitious project. And I'm going to talk about results from 3 of the studies today. Again, I can't talk about everything due to time, but we did two surveys. So we did a survey of dietitians and a survey of oral health professionals in 2021. And we also did qualitative interviews of dietitians and oral health professionals in 2022 and 2023. So again, I'm going to talk a little bit first about the survey study. So this was, again, Amanda's project, and she did help make some of these slides. So I want to give her credit for that too as well. So the overall objective of this study was to describe and characterize the perceived knowledge, attitudes, and practices of dietitians regarding nutrition to prevent and manage dental caries in Canada. And we do have a manuscript for this under preparation right now, and it should be submitted soon. So we developed a survey through a multi-step process. We did a literature review, we created a draft survey. We then had an expert review panel give us feedback on our survey. We revised the survey, mounted it on an online platform. We actually did cognitive interviews as well too, to get people's thoughts as they were completing the survey. We made further refinements, and then we translated the survey into French as well too. We recruited dietitians from across Canada through different channels, and the survey was open for 2 months in 2021. So it was during COVID. And some of the questions that we asked them in a way that we would capture information on things that happened before COVID too, because we knew that that probably wasn't going to be completely representative, because some blood programs did shut down at that time. So we obtained 235 valid survey responses, and just a snapshot of demographics. About 2/3 of our sample was under 40 years of age, mostly female. 3/4 of our participants had 20 years of work experience or less as a dietitian. Most had a bachelor's degree, and the top 2 provinces of residence for our participants were BC and Saskatchewan. So I'm not going to spend much time on this, but just showing that these are the top 5 practice areas of respondents that we had fill out the survey. But again, we had respondents from other practice areas. So these are just the top 5 most common ones. And again, these were also the top employers as well too for response. But again, we had respondents from all different employers as well too. These are just the top answers here. So for self-reported knowledge on various topics related to nutrition and dental caries, on the y-axis, I have information about number of participants who reported good, very good, or excellent knowledge levels on this topic. And the dietitians in our survey, 75% reported that good, very good, excellent knowledge level on foods that promote dental caries, but foods that are protective against dental caries, and eating behaviors that could be protective against dental caries, such as your frequency of eating, were less. They had less of them reported those good, very good, and excellent knowledge levels. This was a striking response from our survey. 85.5% of respondents had not received, self-reported not receiving any training on nutrition and dental caries. So we found this to be this is a very interesting finding. This is something that I would like to address in the future as well too. For attitudes, again, I have here the respondents who agree or strongly agree with the listed statement here, the percent of respondents that agree or strongly agree. And you can see here that the vast majority of respondents had very positive attitudes about dental caries being a concern, and that there's a strong relationship between nutrition and dental caries. Now here I also have a percent of respondents who agree or strongly agree with the listed statement. And almost all of respondents said that they felt that collaboration between dietetics practitioners and oral health professionals was important for oral health prevention, oral health promotion and disease prevention. And 70.9% of respondents felt that dietitians should have an expanded role in this area, and less felt so about oral health professionals too. We still had lots who did feel that way as well too. Now I'm going to talk about attitudes about interprofessional collaboration. Um, we found that 65.8% of respondents reported feeling not at all comfortable or slightly comfortable or moderately comfortable. So this is fairly low comfort levels with consulting an oral health professional about nutrition and dental caries. But 70.7% of respondents reported feeling somewhat interested or very interested in consulting with an oral health professional in the future. So they didn't feel very comfortable about right now, but they're very interested in the future. So I thought this was quite positive. Now I'm going to move on to talking about practices related to nutrition and dental caries. And what we did was we asked them how many of them did frequently or occasionally conducted these activities in their practice in the last sort of 5 years. And it's not a perfect response, but again, we were COVID, so it was a bit tough, but to get accurate data. But we did find that nutrition counseling was the most common practice in this area reported by dietitians. And they did report doing other practices in this area too, such as presentations on this topic, developing resources and that kind of thing too. So there were a lot of different activities that were being done in this area. But I would say overall, this shows that the practices in this area are quite low in our respondents from this survey. And we also found too that not very many of our respondents had consulted with an oral health professional about something regarding nutrition dental caries. It could be a patient referral, it could be doing a presentation, it could be developing a resource. There wasn't a lot of crosstalk between the dietetic profession and oral health profession. Now, lastly, for the survey, I want to talk about barriers that were identified to working in this area. So we found that about 60% of respondents had reported experiencing some kind of barrier to working in this area. And the top two barriers that were reported by respondents were not enough knowledge and not enough training on this topic. But you can see here that there were some other barriers too, like not having enough time, not knowing where to go get more information, and that kind of thing too. So again, the barriers were diverse, but again, insufficient knowledge and not enough training were the top two. So now I'm going to talk a little bit about the dietitian interview study. I'm only going to scratch the surface of this because some of the results do overlap with the survey and just for time's sake. So the objective of this study was to explore the perspectives of dietitians regarding nutrition for the prevention and management of oral diseases. And the interviews for this project were done by Amanda and Nikki. So we had 19 interviews conducted from dietitians from various practice areas across Canada. Again, 19 is not a big number, but again, it's a start in this area. And again, there's so little research in this area that it is a good start. Interviews were conducted by trained research assistants, and they were analyzed using Braun and Clark's thematic analysis approach by an external analyst at the Canadian Hub for Applied Social Research. So we had respondents from different practice areas, so including private practice, long-term care, inpatient, outpatients, and public health and community as well too. And we had 4 themes that came up from this project. I'm not going to talk about theme 1 and 2 due to time, but I will touch on theme 3 and theme 4. So theme 3 is collaboration between dietitians and oral health professionals. So one thing that came up here that didn't come up in the survey that I wanted to mention was that some respondents expressed that there was a common perception that oral health issues fall primarily under the purview of oral health professionals and not so much of dietitians. And they also mentioned that sometimes patients view oral health under the scope of their oral health professionals. They're not likely to go to dietitians about this topic for anything. So this is one quote here that sums that up. So yeah, it's just not part of our scope of practice. One other comment that came up too, and I have seen this before in other literature too as well, and on an online sources too, is that a few respondents did report concerns also about conflicting information provided by oral health professionals and dietitians. So sometimes the recommendations are they're just not on the same page. They may be both correct and good, but they're looking at different things. So this quote summarizes this point well. For example, in the summertime, I really encourage people to drink more fluids, and some people think Some people don't like to drink water, but I will suggest lemon or lime water or any flavored water. But when you talk to the dentist, they will say that if you drink lemon water throughout the day, it's not good for your teeth because it could cause dental erosion. That's where they're going at because it's acidic. It's kind of conflicting recommendation between the two professions again. So they're both valid points. They're just different perspectives. And lastly, I want to talk about some of the solutions that the respondents reported to help improve involvement and collaboration in this area. So again, this is a big wish list of things. Again, it would be this is takes years to do all of these things, but I think it's important to capture this information so we can start thinking about and building at this over time, both as a bigger profession and also at grassroots level too as well. So enhancing education on oral health among dietitians, developing guidelines and recommendations on this topic, like maybe a national oral health and nutrition guideline, allocating time and staffing for this, increase communication between oral health professionals and dietitians, and this could be done using a lot of different strategies, increasing awareness of each other's role too, incorporating more oral health professionals onto different care teams, increasing support for professional associations, and establishing referral pathways too. So again, this is it's a grand list, but again, there even small changes can help make a big difference in this area. So now I'm going to talk a little bit about some of the oral health professional perspectives on this topic, and this will be the last thing I talk about, and then I'll do a quick wrap up of everything. So the objective of this study was similar to the dietitian interview study, where it was to explore the perspectives of oral health professionals regarding nutrition for the prevention and management of oral diseases, again, with the focus on dental caries, but again, other things came up. And this was part of Nagine's PhD work, and she is still completing the analysis on this, but I do have some information to share today for you. So we had 18 interviews conducted with oral health professionals from various practice areas across Canada. We have representation from 4 provinces, and these were included for analysis. They were conducted by a trained research assistant, and again, they were analyzed using Braun and Clark's thematic analysis approach by a trained PhD student. So we had a good mix of participants who reported working both in public and private practice. Some worked in one only, some worked in both, and some had experience working in one and now the other. So I think we had a good representation of that. Most of our participants were dental hygienists. So unfortunately, we did not capture many perspectives from dentists, but we do have some dental assistants and dental therapists and some dual trained professionals as well too. So that was good. But again, it's a small sample size. Again, it's a start in this area. So these are the themes that have been identified so far from our analysis. And again, the analysis is still in progress, and I won't have time to go through everything. But I am going to talk about a couple of things from this analysis that I think would be of interest to the audience. So the first thing I want to talk about is comfort levels and challenges in addressing nutrition and dental caries. So a range of comfort levels on nutrition and dental caries was found among the oral health professional participants, and the range appeared to be from very comfortable to fairly comfortable. And many participants found it quite routine to discuss nutrition and dental caries and found to be quite familiar with this subject. And so this is a quote here: as a dental hygienist, one of our competencies is nutrition counseling or education. So as a dental hygienist, we're quite comfortable discussing nutrition and diet and things like that in terms of somebody keeping their mouth healthy. However, although most participants felt comfortable providing information about diet and dental caries, some mentioned that despite their overall comfort, discussing more complex topics was challenging due to their limited knowledge in this area. So topics like sugar amount, frequency, and acid tended to be comfortable, but topics outside of this tended to be less comfortable, and where they were wanting some more help from that. So this is a quote here talking about how they're less comfortable with the topic of artificial sweeteners too as well. So again, sugar, acid, caries, comfortable, but less so about some of the topics. This was some of the participants. So now I'm going to talk about some of the barriers that they identified to working in the area of nutrition and dental caries. And some of these barriers were quite similar to what the dietitians reported as well too, which is interesting. So again, I'm going to just scratch the surface here, but lack of knowledge was a common barrier. And some participants mentioned that a lack of knowledge can be a barrier to effectively delivering messages on nutrition and dental caries. And some pointed that they're not experts in answering all questions related to nutrition, dental caries, and oral health. And when clients ask detailed questions, they may not know how to respond adequately. Some of them did provide referrals to dietitians, but others didn't know where to go. And limited training during their studies was also another barrier for many oral health professionals when addressing this topic of nutrition and dental caries. They noted that they received some education on caries and nutrition when they're in their training to become an oral health professional, but they often it wasn't really enough, and they had to sometimes learn about this more on the job too. So again, it wasn't enough, but they did get some. Many oral health professionals also shared that time constraints made it tough to focus on nutrition during their appointments. And with limited time, they often have to prioritize urgent dental issues over discussing things about diet. And this means that they can't always have in-depth conversations about dietary habits. And so it led to short discussions and missed discussions as well too. So again, not as much as they thought was probably needed. Um, Also, too, the cost of nutrition counseling in this came up too as well. So that for themselves, they mentioned it may not be prioritized because it's sometimes not a billable service, and then therefore they didn't have time for it. And also, some participants mentioned if they could bill for it, many of their clients probably wouldn't pay for it either. So if they did feel that they might need a little bit of a few pointers, they'd have to do it on their own time, such as during their lunchtime or on their break too as well. So again, not really getting the supports that they needed, and a lack of referrals as well too. So there was lack of a referral system to address this topic too as well. This came up also with the dietitians too. I want to talk about one facilitator as well that came up that they identified is that the participants highlighted that the importance of established collaborative pathways and the proximity of working environments, which includes a space for communication, as being important facilitators for referrals and collaborative efforts in the area. And they mentioned that having a system for referrals, such as knowing where to find and how to refer to other professionals, such as dietitians, attending each other's meetings and working in the same building, help them to understand each other's roles and collaborate effectively. So again, they thought that having being able to, for example, eat lunch together or be in the same building to talk about those things, developing those personal relationships were really important for helping to facilitate collaboration. And lastly, I'm just going to talk about some of the future needs that the oral health professional participants identified. Again, some of these overlap with the dietitian ones too as well. So all the participants expressed a desire for continuing education on this topic. In-person and virtual were suggested. And some of them also wanted training by dietitians on these topics too as well. So, and then also too, a participant noted that it's nice to have consistent messaging between the two professions as well too. And dietitians were felt to have a really important role in this area. So if people hear the same advice from both types of health professionals, it really reinforced the message and increased the credibility too as well. So they really wanted that's saying the same messages, and different professions saying the same messages too as well. And they also mentioned that collaboration between professional associations was essential because it really fostered more collaboration too, as well at local level. And they also thought that it would be great if professional associations could collaborate and develop some resources together too, and conferences and that kind of thing. I think that's a really fantastic idea as well too. So again, we have results from 4 studies here. We are working on manuscripts for all 4 of them, so stay tuned. But I just want to end off with a couple of take-home messages, and then I'm going to talk about a few resources as well that might be helpful takeaways. So again, there was lots of enthusiasm on this topic, but practices can, in many cases, be limited, and there's a lot of barriers in practice and many of the barriers were similar between the two professions. More education on this topic is needed and desired for both professions. And so I'm trying to make a bit of a difference here. I'm going to be doing some training for our nutrition students at the University of Saskatchewan next term on nutrition and oral health too. So trying to just do little baby steps with that. And also collaborative work is needed to develop national nutrition and oral health guidelines too as well. So I think this is a very it's this is dreaming, but I think this would help address some of these barriers, and I think it's time to start working on some of this. And change is going to take time on this topic. It's again, there's a lot of barriers, but I think what I want to say is that grassroots activities are a way to become involved now. So doing small things, doing presentations in your community, dropping off, connecting with oral health professionals in your community, doing presentations, reading about this topic. All these little things are going to make a big difference as well too. So again, it's going to take time, but I think everyone has an important role in this. So I'm just going to end on some resources on nutrition and oral health. So Canadian Oral Health Professional Associations and some other professional associations have a lot of really wonderful resources on oral health, and some of them do have resources on nutrition. And the dental hygienists associations we found that they have quite a few things. So again, if you are interested in sort of patient handouts on this topic, they do have some of this stuff out there already. Unlock Food and Pen have some content on oral health too as well. And I also, this past summer, I worked with an MPH student from the University of Saskatchewan, Samia Hussain, and Dr. Amrinder Singh from the College of Dentistry. And we spent some time looking at nutrition and oral health guidelines around the world. And we did find that there are quite a few out there. And so I have screenshots from different ones here. So we have some of the American Dental Association, NHS Health Scotland, and Australia. They have some documents too. And there was a Brazilian position paper on added sugar too, as well. The American Academy of Pediatric Dentistry also has some policy statements as well too, and the British Society of Pediatrics. So these are some things. If you are interested in reading more about these topics, there are some international resources. And lastly, the Academy of Nutrition and Dietetics does have a position paper on diet and oral health and nutrition. It is older, but again, a lot of the information is still good in there. And also, the document I showed on one of the first slides also has this document again was a collaborative statement from Australia and with Dental Health Services Australia and Dietitians Australia, and it was a collaborative position statement. So again, this is another one that I suggest taking a look at too if you are interested in more on this topic. So thank you so much for attending. It was my pleasure to be here. And I don't know if we have any time for questions or not. I'm not sure, but thank you.
We might have about 3 minutes,
Okay,
so I'll ask a few things and we'll see
okay,
how far we get.
okay.
The first thing was, first of all, thank you very much. That's so informative. Will the slides be shared post seminar? Can
Yes,
you?
we will share the, yes, we will, we'll have the slides. And if you, uh, yeah, and if you want any more information too, you can send me an email as well too as well. I'll do my best to get back to everyone.
Great. Okay, we'll just go in and I'll ask a few questions. Is there any impact of prolonged breastfeeding on oral health in early childhood?
I think this is a tough question to answer. We know breastfeeding is the best way to feed infants. It's what's recommended. Um, but I think there has been some, and I have to go back and look, but I think there has been some, if it's breastfed for a long time, I think there has been a little bit of work on, a little bit of suggestion that they may cause caries. But again, I want to be very careful here because breastfeeding is really the best way to feed infants, and I feel very strongly about that. But I do know too you also want to be careful with the milk pooling in the mouth too as well, and again, just wiping the mouth out with if there's any concerns about that, just wiping the mouth out after feeding as well too can be helpful. But again, breastfeeding is the best way to feed infants, and so again, I think this is it's a difficult question to answer, but I hope I answered that as best I could. So, yeah.
Are there studies that prove rinsing with water is effective at reducing decay?
You know, I I actually don't know if I've ever looked at that specifically, but it is so commonly recommended in guidance that, and it makes sense that it does. Um, but there may be studies out there. I could get back to, I could answer that one maybe in a in an appendix for this presentation as well too. But again, rinsing with water, we actually did do some research. It has been accepted in JAMR formative research, and we looked at uh, recommendations from uh, national professional associations in Canada on nutrition and oral health, and drinking water and rinsing mouth out with water was one of the most common recommendations that we saw in that work. So again, I think it's a good thing to do. So again, I don't know if that answers that question or not, but
Okay.
yeah, yeah.
Yeah, thanks. Okay, so we have lots of other questions, but we have run out of time. We'll try and collect these questions though, and
Yeah,
hopefully
I'd
do.
be happy to answer them after, and we can paste we can add an appendix onto the presentation. Is that what we could maybe do?
Okay,
Okay.
yeah,
Yeah, yeah, I'd be
great.
happy to do that. Yeah. Yeah.
All right. So thank you again to Halion for their support of this webinar. Thank you to Dietitians of Canada for their support, our CFDR Board of Directors, our Volunteer Executive Director, Janice Randall Simpson. Just to note that on our website, we do have a donate today little button. If you feel like you want to donate anything to support CFDR, we would love that. And of course, thank you to Jessica for this amazing webinar and all the information she shared with us today. And a reminder of the webinar next week, 12 p.m. Eastern Time, Thursday, September 25th. And with that, I will close the webinar and thank everybody for attending and have a great day. Bye.